So it feels like I haven't left the house in ages since the birth of my second son. So today is going to be a collaboration vlog. I am going to be meeting up with Abdul and the CEO and founder of Avegen Health. And we're going to be going through the day in the life of a CEO of another health tech company. So yeah, let's get the show on the road. So we met Nayan, the CEO and founder of Avegen Health, through our podcast actually. We saw that he was building some incredible, insane products, getting it out into the market, collaborating with the industry, as well as providers, getting it into all sorts of settings globally as well. So he's doing some great work, and I actually also even went to one of his launch events at the London Business School, which was super cool. Met loads of insanely smart people there. So after the podcast as well, right, there were lots of synergies between myself, Abdul, and Nayan, our company missions and goals, right? So actually we even collaborated on delivering a whole health tech fellowship, right, to lots of senior consultants. And I'd say a lot of those, I want to say all the consultants went on to secure some sort of advisory role or some sort of work with health tech companies. So they've also added that to their portfolio. And before the whole fellowship, it was purely clinical. So all of them with 100% rate, I think, I want to say 100%, have gone on and landed something. Now, we haven't done a second cohort. We've been thinking about it, but there's just so much to always do, right? So we've not had much time to build out the program for a second cohort. It's definitely on the roadmap. I definitely want to do it because I feel like there's a whole generation coming through that need to learn about the world of health tech, product, AI now. It's a big thing, right? So we need to upskill the workforce, and I want to be a part of that. I want to be a part of the delivery service. I feel like there's a lot of people out there that know a lot, and if I can just bring them together to deliver it, we can upskill the whole workforce digitally through peer. That's the goal. So one of the things I'm super grateful for to Nayan is that he's one of those really successful people who could easily ignore us. But he was one of the first to believe in us. And I mean truly believe in us, right? Not just give kind words, because he was brutal at times as well. Because he was like, if you guys don't figure out what the product value is, what the value proposition is, you might need to just pack up shop, go and work for someone and figure it out from the inside. So he was brutal at times. But he gave super encouraging feedback always, and he was always saying, come on, keep going, find a way, break through the gates. And I feel like we've come a long way because of people like him rooting for us. Like I said, there's a lot, I've said it on the previous vlog, there's a lot of people who've been rooting for us, and we're here because of what they've done for us. Nayan is one of those. So Nayan, if you're watching, you are one of those people.
Find the office. I'll show you guys around.
Like a normal cappuccino, man. What is this?
Mix it like a set stuff.
Oh. No, kind of then. If I click on your face, hold on. So I'm going to show our gadget around now, okay? So if I click on your face, it will track you and you can walk around and it will just... So yeah, this thing records in 4K, it tracks you, it's got great sound. 600 quid. So it sets you back a little bit, but...
Sorry to interrupt. We're recording. Do you mind just introducing yourselves and what you guys do?
Hi, I'm Emily. I'm a product analyst at Avegen.
Awesome.
Hi, I'm Holly and I work in marketing at Avegen.
Hi, my name is Afan. Currently doing work experience here at Avegen.
Oh, awesome. Thank you, chaps.
Thank you.
Sure. So, hi, I'm Emily. I'm a product analyst at Avegen. My background was originally in psychology, but health psychology, so focusing on individuals with various long-term health conditions. And I guess I always wanted to work within the healthcare space. I did think, actually, probably up until the end of last year, that I wanted to train as a health psychologist, but I think since converting to full-time at Avegen, which I did in October as a product analyst, so just kind of taken a different route and essentially want to focus within the digital health space. Great question. So in terms of my role, and it would obviously vary company to company, but in terms of specifically to Avegen, there's two different product analysts, and I'd say mine is slightly more focused on the initial research product development side of things. Yeah. So it would be around kind of speaking to users, speaking to customers, learning what it is learning what problems our product could potentially solve with both patients, clients, etc. So those are different people. Then actually taking those ideas and building the product. So it goes through, say, kind of a few set stages. So the first would be those discussions, whether that's conducting workshops, whether that's like desk research, it's a bit varied. Then we would take that and create almost like a user flow. So the different stages that a user might pass through within a product, create different mock-ups, wireframes from that, and then create what we would call a functional specification document, which would then be passed to the engineers. But one thing I would say about product and why I like it so much is because I feel like you get a real insight into the entire business, because you have to communicate with the end user, but within Avegen itself, like you have to work with the designers, you have to work with the engineers, with the sales team, with commercial, etc. So yeah, it's very varied. I think, and I'm definitely still learning, but I think one big learning that I've kind of gained in the last 5 months or so is just how important detail is, because I think the way that definitely the way that I communicate in comparison to the way that the engineers communicate is, if anything, I think I probably go too quickly to the broad picture, whereas actually they need like the fine detail, they need specifics. And I have looked at some coding things, like I definitely don't know how to code, but we've done some practice coding sessions just because I think that's helpful in terms of actually visualizing what it is that they're doing on a day-to-day basis, and something that I might think is really simple to change in code or within product, within an app, can actually take days. Because of my health or psychology background, so my previous manager at Avegen, she isn't here anymore, but she actually worked at King's with me in research. Okay. So I started off in more of a researchy role. Yeah. It was still very much related to healthcare, but I basically found it through her, which isn't very helpful. But I think networking. So networking. Yeah, definitely networking. Like I studied at King's, so I knew a few people within that space. Then started, as I said, within research, within health. Yeah. And then kind of found it. And you can find, like, I've seen product roles obviously on LinkedIn, but I think because I had the opportunity as well to like watch her, really find out what she was doing, because I knew her whilst I was still working at King's, so have a few different conversations. I then felt like when I came into Avegen, I probably had a clearer idea of what she did. Whereas I think just reading a job description is sometimes hard to grasp. Yep. So in terms of, it's very varied as a start. I think in general, like if I take like if I take today, for example, or a Monday, I'll start with the Monday. We typically have a morning product sprinkle. So the entire team, we have a backlog of all the tasks that we're going to work on in product, and then on a week by week basis, we decide what it is that we're going to work on in that week, and that's our sprint for the week. So we'd go through that, kind of create a general plan in a meeting, then go away, obviously start our tasks. For me at the moment, I'm actually, which is probably slightly different for product, I'm doing quite a lot of content creation and content writing. And alongside that comes working with our designer to build that content, make sure it's looking interesting to the user, engaging, etc. So that would be part of my day. I'm also currently doing a product management course, which maybe is slightly different, but just in terms of upskilling, that's something that I'm working on currently. Then we would potentially have like various different meetings with customers around different user flows, updates on the products we're building, just general feedback. So if we've created mock-ups for apps, then we would show them in these calls, get feedback. Then I would probably take that back to the designer, say this feedback, make edits, etc. from there. I've literally just done this in my course. That's what I was listening to before you called me in. I think firstly, it depends on, as a starting point, I feel like it very much depends on the customer. So I think in an initial call, you want it to be as broad as possible. It's about kind of building that rapport, understanding actually what it is that they want. I think one thing to really hone in on, which is definitely something that I've learned, is figuring out like their need, where they're struggling, and how then what we're creating can actually solve that problem or that unmet need. As I said, keep them as broad as possible, open-ended, try and find some common ground as well, because I think if you've got an understanding set of what it is that they really want, then it's much easier to build on that. Also, where possible, make sure you're not talking as much as them. I think you want to create a scenario where the questions you've asked actually lead them to be talking much more than you, and also make sure that you're not leading with, because it's very easy. I mean, I do it, we all do it, to bias certain responses. So I guess if you're not speaking as much, then it's more difficult for you to bias what they're saying. So you want something that's, I would say, convenient. I feel like one of the main, maybe that's really simplifying it down, but I feel like one of the things that humans love is convenience. So if you have a digital health app that meets the needs that they want within a single app, is engaging, something that they want to be returning back to over and over again, and also can be returning back to over and over again. So I think convenience, something that's engaging, and also something that's easy to use. You don't want to be making their life more difficult by giving them this additional product to learn how to use. And yeah, that's a tricky question though, actually. Again, very much a learning. I think for me, at the stage that I'm at in my career, it's something that I'm learning alongside Nayan to do. I think in those instances, like, being the impartial party to a certain extent is helpful, and I think you want to remind everyone that actually the main focus that you're on is making the product that you're all working towards creating better. I think it's just taking the time to make sure that you're listening to each individual person, because the worst thing you can do is make it seem that actually like one person's idea isn't valid, even if it's not necessarily something that you're going to be going with like at that particular moment in time, just making sure that they still feel heard. And rather than like, no, we're not doing that approach, more of like a great idea, maybe not right for now, but that's something that we can potentially look at in the future. It's just not quite right for right now. I think I feel like I learn well from doing and listening to other people, but I think it's just having as many conversations as you can have with the different teams, because I do think the more I get into it, the more I'm like, that's such a huge part of the role, is if you're not all working well together, like it's not going to work. So I think ensuring that even if you're not, as you said, like a top class coder, or you're not, like, I'm not massively creative, I'm definitely not a designer, but like taking the time to understand actually what each individual person can bring to the product, and making sure that they're all being heard as well. Kind of learning what you can from those different people too.
Hey everyone, so we are in one of the most central locations ever. I don't know if you can swing the camera in King's Cross Station, where Avegen Health is based. I'm with Dr. Nayan, who is the CEO and founder. He's been on the podcast a while ago. But yeah, we want to kind of do this series where we go into the life of a CEO, a founder building in health tech, healthcare, really find out about, the mission, the vision, what's been working well, what hasn't. So yeah, quick introduction and then we'll take it from there.
Thanks, Abdul. So my name is Nayan. I'm the CEO and co-founder of Avegen. And Avegen was founded because we felt that healthcare should become a lot more patient-centric. So what we've done is we've built a platform which allows us to launch digital health solutions very quickly. Today, I think we've launched more than 18 solutions in different countries. I think we're currently in 14 or 15 countries, and we have more than 2 million users who have downloaded and used our solutions.
If you had to break it down in a simple sentence, what do you actually do? What is it Avegen's about?
That's I think a question that all of us we do try to answer that a lot. In simple language, I think what we're doing is building products that enable patients to manage their health better. That's what we do, while also helping the doctors and nurses support these patients in a lot more in a more efficient manner. So.
Yeah.
Guys, I'm going to stop you there because this thing is not waterproof.
All right, we're going to call it.
We're going to have to move inside right now.
All right, so change of plans. Founders are tough and rough and can go for anything, but we can't handle a bit of rain.
We're putting Nayan through the range.
Yeah. So we're back into nice cozy bits. So we've touched upon kind of who you are, what you're building at Avegen Health, and I agree with what you describe as you allow kind of these digital health solutions, these digital apps to solve some of these problems patients are facing or in the delivery, but very niche.
Yeah.
And we'll talk about some of the projects you're doing. So it's not very generic, it's very tailored to some of these specific chronic illnesses or disease that have a high burden. Why don't you give us one or two examples of some of these apps or digital solutions that have done well?
Yeah.
I know you've got some good news recently as well. Tell us about that process and what that looks like.
Yeah, happy to. I think one of the solutions that we'll hopefully be launching soon is a product called Orbi, and the whole idea came from an academician, a psychologist, who spent a good 20-25 years researching what the impact health, physical disease has on the mental health of the patient. And what she found, and it's very widely accepted today, that patients who have a physical disease also, it leads to psychological distress, and because of that the outcomes are worse. I think there was a study that was recently published which said that if a patient has depression, and they followed these patients for their whole life, they found out that they had, I think, 3 other diseases, while patients who did not have depression had only 2 other diseases. So we know that there is an interplay between the physical health and the mental health, and the psychological distress that happens is for patients who have physical health is different. So what she did, she researched on how can we reduce the psychological distress in patients with physical illnesses, and very successful study. Now what we've done is we've licensed that intervention from her, and we want to now bring it to the market initially in the UK, but also in other countries. And that is because today, I think only 30% of patients who have psychological distress because of a long-term condition get sufficient psychological support. So there's a huge need from a patient perspective for more targeted support. We are in the early phases yet, so we'll hopefully launch it in the second quarter. We've found a lot of interest from charities who say, look, this is something that our stakeholders really are asking for. So that's one which we are very excited about. And in terms of what we have delivered, I think one of the things that I'm really proud of is what we've done at Chelsea Westminster with their HIV team. When we initially started working with them, what they said is that patients who are stable have to come in for an annual check. Now, some of the times the patients might not need to come in, but they need to be reviewed. So we launched our solution there, where what happens is that the patient gets a notification to say complete a survey in simple words. That data is shared with the clinician, and then the clinician can triage the patient, and then this whole interaction can happen virtually. The benefit for the patient is that they're still receiving the support that they need from the clinical team, while for the clinicians, they are actually spending more of their time on patients who actually need to be met face to face. So obviously, because of that, we have released appointments, we have generated cost savings for them. They're more compliant with the requirements from a registry perspective, and for a patient, it's just improved their patient satisfaction. And today, that solution is responsible for 85% of the patient initiated follow-ups that is done with the trust. I mean, a lot of people talk about PIFU, and we've actually shown with this that PIFU can actually be a key strategy to reduce the wait list, and while not compromising on patient care.
Yeah.
Amazing.
I've got a question. Let me ask a quick question for the community, right? So Avegen have launched, I see on the poster, 18 digital health solutions, right? Our community are super interested in how do you launch products? What's the Avegen validation method, or how do you know whether an idea is worth to build, release into the market, whether it solves a pain problem? I'd love to learn a little bit about that.
Absolutely. Fantastic question. So when we started the company, my key insight, having done a lot of digital solutions, is that most teams end up, taking years to build a solution and launch it. And at the end of the day, the proof is only when patients use it, clinicians use it, and we see benefits either from an outcome perspective or from a cost perspective. So our hypothesis was that rather than building these fancy models, let's find ways and mechanisms to bring these solutions to the hands of the end users as quickly as possible. So to your question, how do we validate it? We validate it for software which is very routine. You build it as quickly as possible, you give it to the hands of the users, you get their feedback. Things that work, you continue to make it better. Things that don't work, you stop. So that's the way we believe software products to be built. It is very novel, I think, in healthcare to do that, because we are so used to taking years and years to build something, try something, and then scale it up. I think we are trying to do what is very common in the tech world. You build quickly, you ship quickly, and you learn from your users, and they will give you the feedback about if it works or doesn't work. So
and to follow up on that, right, how do you know if you should iterate or to kill off the idea, as in to pivot the idea slightly, or just outright it doesn't work, just kill it off? How do you know the difference?
yeah, I think the key difference is primarily the uptake. So what we generally end up doing is that for every solution, we try and categorize it into, is this something that is a high frequency solution, which is a patient needs to interact with it on a daily basis, or is it a medium frequency, which might be like once a week or once a month, or it is a low frequency, that is you come back to the solution maybe once in 3 months or 6 months. So once we are clear about what is the frequency of interaction that is required, then we can use that as a North Star. So obviously you can get downloads and installs and registrations, but what you try and see is that, okay, we think that for a migraine solution, the patient should be coming back and using it at least once a week. So if 2% of the people are using it, then that means it's clearly not delivering any value to the user.
So I was just looking at there's this banner, and Ams might record it. And if you go into the bottom, you can see Jensen, MSD, J&J, Genentech. These are some of the biggest pharma medical device companies in the world. What are the use cases? So I understand the use case as a clinician for hospitals, delivering care for patients that need to manage their conditions, high frequency versus low frequency. We might have a pharma exec or someone listening to this. What is the use case for pharma? How can they kind of benefit from what Avegen is providing?
Yeah, so see, at the end of the day, what the pharma companies are trying to do is that they're trying to get their medicines to as many patients that would benefit from that medicine, right? That's their primary goal. So, but getting a medicine to the patient, there might be multiple steps are required to get the medicines to the patient. So, can we do early diagnosis? Once they're diagnosed, if they are on first line, is it effective? If it is not effective, can we move them to second line more quickly? If that is not effective, can we move them to the third line very quickly? So the pharmaceutical companies are interested in making sure that every patient who could benefit from that medicine gets those medicines, and that is where our solutions come into place. So through educating the patient about what is available, through helping the patient track their own health parameters, what we are ensuring is that the patient is playing a much bigger role in ensuring that they get the medicines that they would benefit from, and once they're on the medication, to support them with ensuring that they are actually adhering to that medication. So that is why pharmaceutical companies work with us. So what they're really trying to focus on is, can every patient get the medicines if it is clinically indicated or relevant to them.
Which makes sense. And I think what you said is a lot of those bottlenecks are bottlenecks due to humans. Clinicians need to diagnose, clinicians need to manage. There's waiting lists, there's massive burdens. If digital health can kind of expedite those processes, more people can get the care they need, or escalation in management. Just taking that step back to you as a founder, as an entrepreneur, building in healthcare, health tech. Tell us a bit more about your roles and responsibilities as the CEO, as the leader of this company. What does your week look like? What are you doing? What does a culture look like you're building here?
I think as CEO, I think it's changed as the company has evolved. We finished 10 years in April, and I think when I started 10 years back, I think me and my co-founder pretty much did everything. I know it's very cliched, but all the way from opening the office to shutting the office to then selling. But as the company has grown, company has evolved, today my role is mostly about ensuring that the right people are in the right role in the company. So people and culture are probably a big part of my responsibility. And the second thing is that ensuring that as a team we are working in synchrony, because it's like, as when you grow bigger, people could be doing a lot of different things, and that could either be chaotic, or if a team is actually working in synchrony, then that could lead to magic. So a lot of my role is to ensure that what is our objective for this quarter, what is our objective for on the commercial side, what is our objective from the product side, engineering side. So I would say that's probably the second big part of my job. And the third one is, sometimes I think, like, stepping in when there is a crisis. So for example, it's not a crisis, but our head of product moved on to a different company. So I have now stepped in till we find a good replacement for that head of product. So that's probably the third one, which is, wherever there are gaps in the company, you as a CEO and sometimes as a founder, you sort of step into that breach so that the team does not, the impact on the team is minimal. So those are, I think, the three roles: people, the second one is team, and the third one is stepping in when there is a crisis or a breach.
Yeah, I think you described it well. The other thing we want to talk about, and a lot of founders are interested in, is for what you're building, you'd expect it to be a very big VC-backed company. However, you've opted to take in a different direction. You've primarily bootstrapped, grew on revenue and profit. Tell us about that decision-making process, and would you ever consider external funding to really scale and grow?
Fantastic question. So I think every industry has its own sort of characteristics and way of working. In healthcare, it does take time. Like, it takes sometimes 6 months, sometimes a year, sometimes actually 18 months, 24 months to get to a place where you get a contract. Now, that is how our sector works. Now, one option is that what you can say is that, let me throw money at it. But I think sometimes throwing money at it or capital at it does not make it grow faster. It actually makes it harder. So for us, either part by design and part just accidentally, we have built a company which is more in synchrony with the way our sector works. And will we ever say no to funding in the future? Maybe not, because there comes a time in our evolution when the extra capital can actually be deployed with a positive ROI. And maybe we are at that stage where we have a very strong foundation, we have a very strong roof. Now for us, getting to the next level of maturity, capital can play a role. So for example, we want to launch in the US. So now if you want to launch in the US, then you need to invest in that market. We want to launch in Asia Pacific, we want to invest in that. But we are taking that investment not for experimentation, a little bit of experimentation, but we've already de-risked a lot. Like, we have a good solid customer base, we have a high percentage of recurring revenue. So an investor who comes in, maybe we're not cut out for a VC model because they are always looking for unicorns. But for an investor who's looking for a company which has strong foundation and will know that capital infusion will, instead of us growing 2 times, we might grow by 6 times. There's less risk and there is more reward. So yes, I mean, if we have the right investor, we will definitely consider taking investment. But we're also in a good place where it's not like without investment we won't grow. We will grow, right? It's just what is the percentage of growth that might get influenced.
Yeah, I think I describe it as sustainable long-term growth. You've been doing it for close to a decade now, and the proof is in the pudding. And we're going to link all the different apps and solutions you have in the market. I think this was good just to get a little insight. We've looked at the office; it's an amazing new office. We've spent some time with the team. We've had some food. You've kindly provided after this amazing news. To wrap up, do you have any questions, Ams, that you think is worth for our viewers?
I think just some advice on anyone who wants to bootstrap an idea. What are the challenges they should be aware of before embarking on that? Should they quit their job and basically go ahead and...
So I think the sooner you go all in, I think it is better. Like, I think even I moonlighted for a while and I realized that it's when I started doing the startup full time, it just moved at a completely different pace. In terms of, I think, advice to people who are bootstrapping, I would say that, introspect, because it's not all businesses are conducive to bootstrapping. Like, for example, if somebody's trying to build a B2C business, I think the investment in brand is very important. Otherwise, people won't believe it, and that is very hard to do. I mean, you could do it, but I think it's harder. So I think it's really about understanding what is it that you're trying to do. Is it B2B? Is it B2C? I think B2B is a lot more conducive to bootstrapping. B2C is a bit more harder. That's I mean, I might be wrong, but that's my sense. I think the reason why we have been able to bootstrap is because we work with B2B, and if you crack it, B2B actually in some way can fund the build of your product. So it's a good model. So.
And one last question: are you happy?
Yeah, 100%. Because I think, I mean, don't get me wrong. There are days when you're like tearing your hair out, but I think there are more. Yeah, so I think more days I'm happy. In percentage wise, right? And I think that's, for me, like just the other day I was discussing with my wife and she said, oh, maybe you should have stayed in corporate. And immediately, without thinking, I'm like, no way. Like, I am doing what I really like to do and I enjoy doing. I work with a fantastic bunch of people, and a lot of the times I'm doing, and I'm not just talking and convincing people. So yeah, so in short, overall, yes, I am very happy.
I think, this was good. Thank you, Nayan. You're busy, for taking out the time to do this. Let us into your office, to your space. I think a lot of people want to know what life is like building a company. And you're very supportive. You've been very supportive to us and in our endeavors, before we had anything. But no, thank you again, Nayan, for this open invitation. And anyone that's looking to build anything, reach out to Nayan Avegen. We'll link it all in the description below.
Sure. On a secure, compliant platform, and so that's where a lot of the conversation has been, and that's where a lot of interest has. Hence why I was after this Alright, hopefully that gives you a bit of insight and flavor. There you have it, day in the life of a CEO of a health tech company, right? So as you saw, being a founder, rarely is it always the glamorous things, right? It is long hours in an office, taking meetings, it's selling, it's pitching, it's managing, it's leadership, it's reviewing, it's removing barriers for team members, it's hiring, planning for certain events down the line. That's the life of a CEO. And then around that, what people see is often the podcasts, they'll see the conference meetings, they'll see speaking on panels, and all of that clout related things, I guess. It's about the hard graft that goes in behind the scene that's unnoticed really and truly. So yeah, there you have it. There's one particular thing that I'd say from the podcast with Nayan, from meeting Nayan, from being with Nayan, that I think he's really taught me, and that's entrepreneurship is not a zero-sum game, right? You don't win at the cost of someone else, you don't lose at the cost of someone else. And that working together, actually, you'd probably get a lot further. I think throughout our schooling and everything in this country in particular, we're taught, right, that we're working against each other. Only one person can come first. And if you're not first, right, someone else is first. You're second and you're 100th. And only the winner is right at the top of the list, basically. And that works all the way through the schooling system, to college, to university. Now, with entrepreneurship, right, it works better if you support each other. It works better if you're opening up your network to each other. It works better if you're doing the introductions to potential customers who might want their product. So entrepreneurship is not a zero-sum game. It's a game of working together and winning together. And what you'll find is that most investors, most startup founders, most people at enterprise and so on and so forth, they will help each other out. They will hook each other up. And that's what they call, in this day and age, networking, right? Why do you network? At the end of the day, people network to share resources, to share deal flow, to share insights, to share that asymmetrical asset, basically. Something someone has that someone doesn't. And sharing is the best way to win. And sharing is the best way to win together. And that's something that I think Nayan really embodies, that working together, we can win together. So one of the things I absolutely hate, right, is traveling during rush hour. So between 8 to 10 in the morning and between 4 to 7 in the evening. I hate it. Had to leave during rush hour, and typical fashion, I get on the train, some person decided to walk down the tunnel. So they just cancelled all the trains. So a 1 hour journey turned into a 2 hour journey, finally getting home. But yeah, I hate traveling during rush hour. Is it just me, or is everyone the same on this one? Are we all in on this one? We can unanimously agree, right?